Welcome to today's class. So in today's class, we are going to be looking at an important topic for nurses. So have you ever wondered, when you are playing football, when you injure yourself or you cut yourself accidentally by a knife, or when a mosquito bites you, what happens to your body for it to repair? So today's topic will help us understand the entire process of what? Inflammation. So by the end of this class, you should be able to define what inflammation is. So you should be able to define inflammation. Second, you also need to describe the two types of inflammation, which is, so you need to describe the two types of inflammation, which are acute and what? Chronic. Then after defining or after naming the two types, you are also going to describe now the process and what? Its clinical features. So third, you need to understand what? The process of inflammation. And also what? The clinical features. Why do you feel pain when you injure yourself? Why does it swell? All those clinical features we are going to talk about them. Then finally, you have to know what? How inflammation ends. So how inflammation ends. Yeah. So stick through to the end of the video so that you are able to understand all these parts of inflammation. Of course, you don't need to study everything on inflammation, but just remember these points I've given you. So to begin, we are going to define what inflammation is. So in short, inflammation, this is just what? A physiological process. So you have to understand that inflammation is what? A physiological process. What do you mean when you say inflammation is a physiological process? So when we say inflammation is a physiological process, we are basically saying that this is a normal response. So whenever you hear something as physiological, just remember that this is what? Normal. So now, how do we define inflammation in terms of physiological? So inflammation is just the physiological response to tissue damaged, which is accompanied by some changes in blood vessels. So in short, you can say that this is just a what? Physiological response to tissue damage, which is what? Accompanied by some changes. So this is how you can what? Define inflammation in short. This is just a physiological response to tissue damage, which is accompanied by changes in blood vessels. So the blood vessels or the capillaries, they undergo what? Changes. So another definition of inflammation, in case you don't want to use the one for physiological, you can just say that this is just what? A protective response. In other terms, because when your tissue is damaged, your body needs to repair before what? Bacteria and other viruses enter your body. So another definition, in case you don't want to use the first one, you can say that this is just a protective response intended to eliminate the initial cause. So this is just a response which is intended to eliminate the initial cause of cell injury. So here we are talking about cell injury. your cell is injured. We know that the skin has cells. So the skin cells, if they are injured, that is what a cause. Of course, they can be injured by a lot of substances. If, for example, you burn yourself, you cut yourself, you injure yourself, or those. So these are the two definitions which you need to remember. So the first one we said is just a physiological response to tissue damage. Then the second one, you can say that is a protective what response intended to eliminate, so to remove the initial cause. Then now that you have understood the two definitions of inflammation, we are going to discuss now the types of inflammation. So what are the types of inflammation? Remember, at the beginning of the video, I told you that we are going to look at two types of inflammation. The first one is acute inflammation. Then the second one is what? Chronic inflammation. So these are the two types of inflammation again which you need to understand. So I'll start by first discussing what acute inflammation is and what point you should do. No, so you should be taking note of this outline I've given you. So I've covered the first part. So now we are on the second part. So this is also how you should be studying to simplify things, because you do not have time to study everything. So what is acute inflammation now? So we are talking about acute now. So acute inflammation is just typically what? Inflammation which is immediate response to what? To tissue damage. So this is what? A type of inflammation which is immediate. Inflammation which is what? Immediate. You injure yourself. So immediate, there is what? Tissue damage. Yeah, so this is the first response. Immediately you injure yourself, the first inflammation which takes place is what? Acute inflammation. So this is what? Short. What you need to know that this is short. It doesn't last long. So this only lasts for minutes, minutes to hours. So in those minutes to hours you injure yourself, the first type of inflammation which will take place is known as what? Acute inflammation. Then what are the aims now? So why does acute inflammation takes place before what? Chronic inflammation. So those are what are known as the aims. So what does it aim to accomplish? So after acute inflammation has taken place, what should we expect? So the first thing which you need to know is what? So we are talking about the aims now. Why does what? Acute take place? So the first aim of acute inflammation is what? To limit tissue damage by containing the affected area to prevent further injury. So the first aim of this process of acute inflammation is just what? To limit the what? The tissue damage. So we don't want that injury to what? To spread to other parts of the body. So that is why acute inflammation takes place, so that so that area is what? Contained. So this is just to limit what? The tissue damage by containing the affected area. Then what is the second now? So The first one is to limit tissue damage. We don't want the damage to reach other parts of the body. Then the second thing, we said that when you injure yourself, you have potential of invasion from what? Microorganisms such as bacteria, viruses, and other. So we don't want you to get infected again. So that's why acute inflammation is there to what? To also do what? Remove the harmful stimuli. So that harmful stimuli can either be a pathogen. So what do we mean when we say a pathogen? So a pathogen can either be a bacteria, a virus, and also what? A fungal. So these are some of the examples of a pathogen which can be removed via what? Acute inflammation. Then the third is what? Healing. So without inflammation, healing cannot take place. So the third important reason why acute inflammation takes place is what? To initiate the healing process. Of course, when you injure yourself, you have to what? To heal. So that healing process is initiated by what? By acute inflammation. So it promotes what? Tissue repair and regeneration. Yeah, so these are the what? The importance of acute inflammation. Why acute inflammation takes place in our body. The first reason is to limit the damage. Second is to remove the stimuli. Can either be pathogen or what? Foreign material or toxins which are produced by this bacteria. Then third is to initiate the process of healing and tissue repair. So this is what you need to understand on acute inflammation. So now, to summarize acute inflammation, we are going to look at some of the characteristics. How can you identify that this is acute inflammation taking place in my body? Of course, you are going to be nurses. You're supposed to identify if your patient is what? Having what? Acute inflammation. So what are some of the characteristics of acute inflammation? So we said that now we are going to look at the characteristics of acute inflammation. How can you identify that this is acute inflammation? So this is an important part of the topic of acute inflammation. These are the questions which you expect in your multiple choice question. They can ask you which of the following are characteristics of acute inflammation. So you need to remember them. So the first one, we say that acute inflammation is rapid. So it is rapid what? Onset. So what do we mean when we say it is rapid and onset? So when we say it is rapid and onset, we are saying that acute inflammation can just occur within minutes to hours. So that is the meaning of rapid and onset. It does not occur for a long period of time. Then the second characteristics which you identify or which will help you to know that this is acute inflammation is localized. So acute inflammation is localized. What do you mean when you say it is localized? It is confined just to the affected area. Confined. What do you mean when you say it is confined? So whenever we say it is confined, we are saying that it is only limited to that affected area. So for example, if a mosquito bites you on the arm, your entire body won't what? won't swell, or your entire body won't be big, because it is acute. It will only affect that part where you was what? Beaten. Then third, how can you identify that this is acute inflammation? So it is what? Self-limiting. What do we say when it is self-limiting? So when we say it is self-limiting, we are saying that it resolves on its own once the cause is removed. So acute inflammation, you do not need to worry about it because it can go on its own. It heals on its own once the pathogen is removed, because we say that this is the physiological response. It's a normal response. Your body is responding to the infection. So it is self-limiting, meaning it does what? It resolves on its own once the what? Underlying cause is removed. Yeah. Then the final characteristics, which is the important among the three characteristics, is known as cardinal signs. So what are the cardinal signs which you need to know that this taking place is what? Acute inflammation. So these cardinal signs, you need to remember them. They are important for MCQ, again, your multiple choice questions. So we have these cardinal signs which you need to know. So the first cardinal sign is what? Redness. Then the second one is swelling. Then the third one is what? Heat. Then the fourth one is what? Pain. And the last one is what? Loss of function. So these 5 cardinal signs are very, very important for acute inflammation. So for you to identify that this is acute inflammation taking place, you need to see these 5 characteristics. So I will explain later on in the video how these characteristics come about. So you just need to know that whenever there is acute inflammation, for those that are light skinned, the first thing you see is the skin would start turning what? Red. Then after turning red, it will start to swell. Then if you touch the area, you will feel a sense of what? Heat. Then in some cases, there is also what? Pain. But if the injury is severe, the organ may also what? Lose its function. Then the final part which you need to know on acute inflammation are the examples. How do you identify that this is what? What are some of the examples of acute inflammation? So the first example of acute inflammation, where acute inflammation occurs, is what? Cuts or wounds. So if you are what? Cutting the vegetables, you accidentally cut yourself. Inflammation takes place. If you burn yourself, also inflammation takes place. Then 3, if infection also occurs, like pneumonia or appendicitis. So we know that appendicitis is inflammation. So if this condition occurs, also acute inflammation does what? Occur. So we have appendicitis and what? Pneumonia. These are some of the examples in which also acute inflammation takes place. Then the fourth example which you need to remember on acute inflammation are allergic reaction. So we have allergic reactions. So what are some of the allergic reactions? So we have insect bite, which can be what? A mosquito. And we can also have some food allergies, which can be to peanuts. Some people are allergic to what? To peanuts. So those are also some of the examples of what? Acute inflammation. So this is everything which you need to understand on acute inflammation. So this is where my part 1 video of inflammation ends. So in the next video, we are going to finish the second part of inflammation. So I've covered acute inflammation. So now in the next video, we are going to cover what? Chronic inflammation. We are going to also know now how the entire process of inflammation takes place. Then also we are going to know the clinical features, how inflammation looks like. Yeah. So to summarize everything we have discussed in this class, we started by looking at the definition where we say that inflammation can be what? A physiological response and a protective response. Then under the types we looked at acute and chronic inflammation, where we say that acute inflammation is what? Immediate response to tissue damage. When you injure yourself immediately, the first thing that happens to your body is the acute inflammation. Then we also looked at why acute is important. The first thing we said is to limit the damage by containing the affected area. The second thing we said is to remove the harmful stimuli from the body. Then the third we said is to what? Initiate healing. Then we also looked at the characteristics which are here. We said it is rapid, localized, self-limiting, and also what? It has 5 cardinal signs, which is redness, swelling, heat, pain, and loss of function. Then we also looked at some of the examples in which acute inflammation takes place. So this is where my video ends. Don't forget to subscribe, hit the bell button so that you don't miss out when my part 2 video is out.